You know, when we were having this the conversation at lunch, when we were talking about this, you were bringing up stem cells and the effect that stem cells are having and stem cell injections on people that have all sorts of serious traumatic injuries. Is that with the brain as well? Have they figured
Yes.
out how to squirt that shit into your dome?
Yeah, in let's see, 2000 and I think 12, I went to Germany, to Düsseldorf, Germany, to work for the doctor there, who was taking autologous stem cells. He'd take out of the patient stem cells, send them to Israel to get them augmented, to increase the amount, and get them back in 48 hours. And then this absolutely incredible three-dimensional positioning needle that used three axes, X, Y, and Z, and was able to go, we drilled a hole in the skull, and we put a needle in directly into the fourth ventricle, which is that fluid compartment in the brain, and injected the stem cells, and it spread out to the brain stem, because this gentleman had a brainstem hemorrhage. And within 48 hours to 72 hours, he started having these improvements. Hearing improved, physical functioning. He was in a wheelchair with a belt to hold him in place. 3 days later, he's not using a belt. For 12 years since he had his stroke, he wasn't able to pick up a coffee cup, a coffee mug, and hold it. He can only use a straw. He was picking up his coffee cup and drinking it. So there are places around the planet that are using stem cells in people with Alzheimer's, with ALS, with traumatic brain injury, and it's getting benefits. There are benefits. In my projects in Beijing, China, the stem cells called mesenchymal stem cells, which are the ones that a lot of the organs come from, in diabetics, injecting one injection of 10 million mesenchymal cells into the patient through an IV. 30% of them lost their diabetes, 45% had a decrease in their insulin requirement, and 25% of them didn't have any effect.
Wow.
And this is a center with 26 MD PhDs in Beijing that tops in their field.
So there's a lot of hope in that as well.
Correct.
Yeah,
Correct.
that seems like something that would, if you're injecting it, especially directly into the traumatic, the area that's experienced trauma.
Yeah, there's a orthopedic buddy of mine, Centero, who's was using autologous stem cells that he pull out a patient and inject it into the knees and get rebuild of the knees without
Well,
needing
that's
surgery.
what I'm hearing too, is about rebuilding cartilage. That people
Correct.
have had bone-on-bone cartilage, they're rebuilding it.
Correct. There are a couple of protocols. There was one by Dr. Alan R. Dunn out of Miami, orthopedic surgeon, who showed that if you go in with the arthroscopic scope and you use a burr, which is like a sandpaper device, and you rub the bone and then inject it with growth hormone, that he was able to get 5 to 10 millimeters of regeneration of cartilage. In our office, we use prolotherapy.
That's huge.
Significant. And he did a Harvard study. His publication came at Harvard. He patented the
10
protocol.
millimeters, that's thick.
10 millimeters.
That's incredible.
Not 10 centimeters, 10 millimeters, 25.
Still, it's like, that's a pad.
Yeah, it's a nice thickness that developed. So, but no one's doing that because it's illegal to use growth hormone in that fashion. Growth hormone has a very restricted use parameters on it.
Why is that? Because like baseball players and shit?
Well, I think that had a lot to do with it.
Public
and
impressions of it?
the stuff works.
Yeah.
It works phenomenally well.
That's so frustrating to me when something that's really, really effective gets illegal because athletes are using it and becoming more effective.
Yeah.
It's so silly.
It's a complete misconception, and it's ludicrous, man.
Yeah, if the true altruistic goal in medicine is to fix people, then why are we being restricted in using the things that we see fixing people?